Section 1. In this section, you'll hear a conversation between a student and the coordinator of the Student Service Centre. First, you have some time to read questions 1 to 3. Now listen to the conversation and answer questions 1 to 3. Hi, sit down, please. How can I help you?
Thank you. I'm a student in the sociology faculty. I'm coming to ask for some information about renting a room in the college or near the campus. My name is Sarah.
Yes, Sarah. How long have you been here in Sydney? You are not new, I suppose.
No, I'm in my second year. I came to Sydney 18 months ago from Korea.
Where are you living now?
I live with my aunt in my cousin's room. It's pretty nice to live with my relatives, but unfortunately my cousin has finished his term and is returning from Britain next week. I have to rent a room for myself.
Yes, it sounds a little unfortunate, but I suppose it's a good chance for you to have a deeper understanding to real world.
I hope so.
Well, what sort of thing are you looking for? What we provide ranges from shared flat to homestay. And of course we have houses with gardens if you like.
No, the house with a garden is obviously out of my price range. Shared flat is not bad, but I prefer a homestay. I enjoy the feeling of living with the family.
When do you plan to begin the rent? Next week, you just said?
No, my cousin is arriving by next week, so I hope to move out by this weekend.
This weekend, okay. The main area we deal with is around the university.
Around the university, aha. Do you have anything near the northern gate of the university? You know, the sociology faculty is near the northern gate.
Before you hear the rest of the conversation, you have some time to look at questions 4 to 10. Now listen to the conversation and answer questions 4 to 10. Yes, what sort of price are you thinking of?
Well, could you give me some idea? You know, I have no experience of renting a room. I don't know what price is reasonable, but I hope it's not over $300.
I see. Usually the homestay ranges from $180 per month.
Only $180?
Yes, to $350 depending on a number of different factors.
What does it depend on?
Well, obviously the quality of the house, the facilities and extra services.
Oh, I don't care about the quality very much, as long as it's clean. As to the facilities, I want the room with the separate bathroom. Kitchen isn't a necessity, because I don't want to cook by myself. I hope to have meals with the family if possible.
Okay, let me check the files. Yes, I think this one might suit you. It's a family house with 2 vacant bedrooms.
How about the owner of the house? I mean, is it a family or...
According to the file, it is a retired lady. She wants to find college students as tenants.
That's great. What's the condition of the rooms?
The bigger bedroom is furnished and with a bathroom, and the rent is $320 per month. The smaller one charges $250. It is furnished too, but without bathroom.
Oh, $320. It's a bit out of my range, but I think I prefer the bigger one. How about the meals?
Well, the rent includes breakfasts and suppers. No lunches, however. You have to buy your lunch.
That's no problem. I usually have my lunch in the college cafeteria.
And that doesn't cover the water bill and electricity fee, but the laundry is included.
Fine. Could you tell me the address?
Yes, it's on 323 West Park Road.
Let me get that down. 323. Okay, it's near the university. So, When can I have a look at the room? You know, I'm a little pressed for time.
The file says the landlady is in every afternoon. So this week, say Friday?
Oh, I'm afraid I can't make it then. I have a lecture on Friday afternoon till 5:30. How about Thursday?
OK, that's fine. Would 5 be OK?
Yes, fine. Just come here.
Yes, here in the student service office. Oh, before I forget, before moving, you have to pay 1 month's rent in advance.
Really? Oh, I didn't know that before. Could I ask why?
As the deposit. You know, in case you damage the property or move out without giving notice. Usually this doesn't happen, but standing in the owner's shoes...
Yes, I understand it all. So that's $320. OK, I'll take the money if I'm satisfied.
Well, a word of advice. Don't forget to get a receipt when you pay the deposit or rent.
Yes, thank you so much.
That is the end of section 1. You now have half a minute to check your answers. Section 2. In this section, you'll hear a radio program on the process of making beer. First, you have some time to read questions 11 to 21. Now listen to the program carefully and answer questions 11 to 21.
Hello and welcome to Gourmet Evening, and this week we're looking at the world's popular beverage, a great favourite today, beer. And in the studio to tell us all about it is Clark Maxwell.
Beer is one of my personal favourite beverages, and I've got a number of facts, tips and trivia about beer to share with you. So, who invented beer and when? What is beer made of? Actually, historians are not entirely sure when beer was invented, but they guess that beer was created accidentally by early nomadic tribes roughly 10,000 years ago. The 4 primary ingredients are malt, hops, yeast and water. Malt, which gives the beer a sweet taste, is made from barley soaked in water until its husks open and sprout. The sprouts are then dried and crushed. The small flowers of the hops vine are added partly because they taste bitter, helping balance the sweetness of the malt. Hops prevent the growth of bacteria that can spoil beer. Yeast is responsible for fermentation, which creates the alcohol and carbonation. Beer makers sometimes use additives or substitutes for malt or hops. Substitutes such as corn or rice can make a beer lighter or cheaper to produce. Adding fruit gives beer a fruity taste. Beer is not high in alcohol, as we know. The lowest type, light beer, contains no more than 2% alcohol, and the highest may reach 6%. Other drinks such as wine are more alcoholic. Wine contains 8 to 20% alcohol. But that is not to say drinking beer is no danger at all. Like all alcoholic beverages, beer can make it difficult to drive and think clearly. Excessive drinking can also lead to liver damage, high blood pressure, stomach ulcers, and other health problems. However, beer also helps prevent some health problems when consumed in moderation. Beer contains a moderate number of vitamins and minerals. Studies have shown that small amounts of alcohol can reduce the risk of heart disease. Beer also contains selenium, a mineral that promotes bone growth. and helps reduce the risk of osteoporosis. I suppose many of you think beer can give you a beer belly, but you are mistaken. Genes determine how fat is deposited. No food or drink can create fat deposits in specific areas of the body. As with all foods, the more calories you consume, the more likely they are to be stored as fat and cause weight gain. Beer contains no fat and averages 150 calories per serving. Well, one more thing. Pay attention to the storage and containers of beer. They will affect its taste. It's a mistake that the taste of beer improves with age, like that of some wines. Beer is a food product that will eventually become stale. It should be stored in a cool, dark location before consumption. And the colour of a bottle can influence the flavour. Brown bottles block out light that reacts with the hops, which could damage the flavour. Green or clear bottles provide little or no protection from light damage. Do you know which country drinks the most beer? Although Britain is even on the list of big consumers, actually, the Czech Republic consumes the most beer, at 156 litres per person per year, followed by Ireland and Germany. That is the end of section 2. You now have half a minute to check your answers. Section 3. Here you'll hear a conversation at the counselling service. First, you have some time to read questions 22 to 30. Now listen to the conversation and answer questions 22 to 30.
Hello, sit down, please.
Thank you. Well, I heard about your counselling service from a friend, and I was really interested. You know, I'm a new student and I don't know how you work, and...
Well, the primary task of our service is to enable you to become more effective in your life, inside and outside the university. I think counselling is valuable if you're feeling that your life has become out of balance in some particular way. For example, it may be that you're experiencing difficulty in managing change, stress or burnout, difficulty with concentration, depression or anxiety, or a recent crisis of some kind. It can really help to talk things over with a counsellor.
I see. After the semester began, I found I was facing tons of decisions that would be made by myself. I felt under stress sometimes.
Yes, most new students have problems like yours. Just as I have said, it's a kind of being out of balance. Much of what we do is to help you get your thinking, feeling, behaviour, or perspective on life back into balance. We'll seek to help you focus on and understand more clearly the issues that concern you.
But the issues are complex, I think. They are about academic, personal, and many other aspects. I don't know how you can help me to decide so many...
Well, we don't decide. We just help. We'll respect your own values, choices, and lifestyle. We work towards highlighting your strengths and inner resources to help you make the choices, resolutions, or changes that are right for you. When you're feeling under pressure, it's easy to lose sight of the many strengths and inner resources that you have.
You mean I have enough strength to solve the problems and make choices?
That's absolutely right. You just lose sight of them sometimes. And it can also be helpful to talk through any difficult decisions or dilemmas with which you may be faced. You don't have to wait until you're in a crisis to come and seek help. Taking the time and space to reflect in the supportive, private and comfortable environment that the counselling service offers you is an effective way to move forward positively in your life.
Is it possible if I prefer a separate waiting area?
Yes. We'll take account of any special requests you may have to protect your confidentiality. The record of your name and other basic information is kept for statistical purposes. Any notes written down about you are identified by a number. No personal information is kept on the computer.
How do I know what particular counselling I need to balance myself?
Well, as you've noticed, when you approach the service for counselling, you will be offered an initial half-hour assessment interview with one of the counsellors. They can answer any questions you may have and help you to assess whether individual counselling is the best way forward for you. It is the initial assessment interview. If it is thought appropriate, a referral can be made to a variety of medical, therapeutic or psychiatric services in the community, or we can just begin weekly counselling sessions.
How do I make an appointment if I need regular counselling?
If you decide to proceed with regular counselling, you will be offered the first available appointment, often with a different counsellor. Each session would be for 50 minutes, and usually you would meet with your counsellor once a week. The average number of sessions that we see people is 5, but that can be extended. You can decide on your preferred time, early morning or late afternoon.
It sounds pretty useful. I hope I can adapt to the new life with your help.
You certainly will. Actually, going away to university is a time of transition and personal development. Evidence suggests that the vast majority of students who have been for counselling do find it a valuable experience.
That is the end of section 3. You now have half a minute to check your answers. Section 4. In this section, you'll hear a lecture on sports injuries. First, you have some time to look at questions 31 to 40. Now listen to the lecture carefully and answer questions 31 to 40.
Morning everyone, and welcome to our regular lecture on health issues. This series of lectures is organised by the Students' Union. It's a great pleasure for me to welcome Mr. David Greenbaum, a physician in sports medicine, to come along and talk to us today.
Thank you. You may doubt what good sports medicine can do to non-athletes like you college students. According to public assumptions, sports medicine doctors deal only with sporting injuries. But actually, we treat general joint problems experienced by average people more than treating people who hurt themselves by playing sports. So, whether you're an athlete or not, a sports medicine physician can help you start off every day on the right foot. If you are a college athlete or a sporty person, you must stay at the top of your game. But how do you maintain best physical fitness? You should be under the watchful eye of your sports team physician. Sports medicine doctors offer total care treatment, such as customized workouts, immediate care of injuries, and surgery when needed. A sports medicine doctor's training falls within the specialty of orthopedic surgery. As such, it focuses on the cartilage, ligaments, and muscles involved in your body's movement. So, how do injuries happen? Most of us take for granted the intricate interactions of our bones, muscles, and ligaments until they are damaged. When injured, these tissues can degenerate, causing your joints to ache and feel stiff. Even ordinary daily movements such as walking and bending may cause a sports injury through overuse. Furthermore, the normal wear and tear on your body's tissue may become more taxing as you age. To prevent such problems, especially as you begin a fitness exercise, your sports medicine doctor offers total care. This includes X-rays to identify potential trouble spots. Afterwards, he helps you set an exercise routine that fits your body's present condition. Do you know your joints? Your body's most complex structural feature is its joints. Your joints allow you to grasp, twist, sit, and even feed yourself. Repetitive motions, however, may lead to chronic overuse of the soft tissue connecting bones at the joints. This overuse can result in injuries such as tennis elbow or even carpal tunnel syndrome. A more severe type of injury occurs when you lose your balance, thereby putting a joint under abnormal stress. Worse still, you could suffer a bone fracture. When a traumatic injury happens, effective medical care is crucial. Improper treatment of any joint injury can cause permanent loss of flexibility and recurring joint pain. As quickly as possible, the doctor applies ice packs to your injury. Ice deters swelling and inflammation, so you feel less pain. After keeping it iced for the first 48 hours after injury, the doctor begins therapeutic exercise of your wounded joint. Recently, a new treatment for degenerating joints has been developed, which is a product called orthokin. The treatment involves combining healing proteins with a sample of the patient's own blood. The injured joint then receives an injection of the mixture. This new technology stimulates our own white blood cells to produce large quantities of protective protein. Our cells make this protein naturally, but not in sufficient amounts to protect the damaged cartilage in our joints. It also has the advantage of convenience and lack of side effects. Here are some suggestions on how to prevent sports injuries. Use appropriate protective equipment. Maintain proper lighting in the training area. Have adequate rest. Avoid alcohol and drugs in order to prevent injuries. Follow a regular fitness training program to improve overall coordination and endurance. Better endurance will absorb pressure and prevent injury. Perform adequate warm-up exercises before training or performance. Avoid performing sports or work when you are sick. Most injuries happen when one is fatigued. Avoid treatment by dubious health practitioners. Use of inappropriate massage, adjustment, and homemade medicine, often with steroids or other non-tested drugs, can cause more damage to the injury. That is the end of section 4. You now have half a minute to check your answers.